Welcome back to the channel. Today we're diving into a serious topic that could save lives. We're talking about pancreatic cancer, a disease that often flies under the radar until it's too late. Pancreatic cancer is one of the deadliest forms of cancer, and early detection is absolutely crucial. Why? Because the pancreas is like the hidden hero of your digestive system, tucked away behind your stomach. It's responsible for producing enzymes that help you break down food and hormones that regulate blood sugar. But when cancer strikes, it can silently wreak havoc before any obvious signs appear. That's why I'm here to arm you with knowledge. We're going to break down 7 symptoms of pancreatic cancer that might surprise you. Remember, knowledge is power, and catching these signs early could make all the difference. Let's talk about jaundice, a condition that turns your skin and the whites of your eyes a yellowish color. Now, jaundice itself isn't always a cause for alarm. It can be a sign of something as simple as a blocked bile duct, which is easily treatable. But here's where things get tricky. Pancreatic cancer, especially if it's located in the head of the pancreas, can also obstruct the bile duct. This happens because the tumor can press on the duct, preventing bile from flowing properly. As bile builds up in the bloodstream, it can lead to that telltale yellowing of the skin and eyes. Now, I know what you're thinking. Doesn't everyone's skin look a bit yellow under certain lighting? And you're right, lighting can play tricks on the eyes. But with jaundice, the yellow discoloration is often more pronounced and noticeable, especially in natural light. So, how do you tell if it's just a lighting issue or something more serious? Well, pay attention to the whites of your eyes. If they start to take on a yellowish hue, that's a more reliable sign of jaundice. And if you notice any yellowing, whether it's subtle or not, it's always best to err on the side of caution and get it checked out by a doctor. Jaundice can also be a sign of liver issues, such as hepatitis or cirrhosis, which affect the liver's ability to process and clear bilirubin from the blood. The liver plays a crucial role in breaking down old red blood cells and removing bilirubin, a yellow pigment, from the body. When the liver is not functioning properly, bilirubin can build up, leading to jaundice. Treatment for jaundice depends on the underlying cause, so it's important to get a proper diagnosis. Your healthcare provider may recommend blood tests, imaging studies, or other diagnostic procedures to determine the cause of jaundice. Once the cause is identified, appropriate treatment can be started to address the issue and alleviate the symptoms. Remember, early detection and treatment are key to managing jaundice effectively and preventing complications. So, if you notice any signs of jaundice, don't hesitate to seek medical attention. Your skin could be telling you an important story about your health. Have you ever stepped on the scale and been pleasantly surprised by a sudden drop in weight, even though you haven't made any major changes to your diet or exercise routine? While it's tempting to celebrate, unexplained weight loss is often a cause for concern, especially when it comes to cancer. You see, cancer cells are like energy vampires. They grow and multiply rapidly, consuming a massive amount of your body's energy stores in the process. This can lead to significant weight loss, even if you're still eating the same amount of food as before. Now, I'm not saying that every pound you shed is a sign of cancer, but if you notice a significant and unexplained drop in your weight, say 5% or more of your body weight within a 6-month period, it's crucial to see your doctor. They can help determine the underlying cause and rule out any serious conditions, including pancreatic cancer. We've all experienced our fair share of stomach aches and tummy troubles. But when it comes to pancreatic cancer, abdominal pain can be a persistent and nagging symptom that shouldn't be ignored. The pancreas sits deep within your abdomen, and as a tumor grows, it can start to press on surrounding organs and nerves. This pressure can cause pain that ranges from a dull ache to a sharp stabbing sensation. One of the tricky things about pancreatic cancer pain is that it can be easy to dismiss as something less serious, especially in its early stages. You might think it's just indigestion, gas, or a pulled muscle. However, unlike those fleeting discomforts, pancreatic cancer pain tends to linger and worsen over time. It's also important to note that the location of the pain can provide clues about the tumor's location. For example, pain that radiates to your back could indicate that the tumor is growing into nearby nerves. Food. It's the fuel that keeps us going, the source of so much joy and satisfaction. It brings people together, creating moments of connection and happiness around the dinner table. But what happens when you lose your appetite? When even the thought of your favorite meal leaves you feeling indifferent? This can be a confusing and distressing experience. While a temporary loss of appetite can be normal, especially during times of stress or illness, a persistent lack of interest in food can be a red flag for a number of health issues, including serious conditions like pancreatic cancer. There are a few reasons why pancreatic cancer can lead to a decreased appetite. Understanding these reasons can help in recognizing the symptoms early. First, as we discussed earlier, the tumor itself can press on surrounding organs, including the stomach and intestines. This physical pressure can cause significant discomfort. This pressure can create a feeling of fullness, even if you've barely eaten anything. It can make meals feel like a chore rather than a pleasure. Second, pancreatic cancer can disrupt the production of digestive enzymes, those little helpers that break down food and allow your body to absorb nutrients. Without these enzymes, digestion becomes a challenge. Without enough enzymes, your body may struggle to digest food properly, leading to nausea, vomiting, and a general feeling of malaise that makes eating unappealing. This can further contribute to a cycle of poor nutrition and declining health. Recognizing these symptoms early and seeking medical advice can make a significant difference. Support from healthcare professionals and loved ones is crucial in navigating these challenges. Nausea and vomiting, they're the dreaded duo that can turn your stomach upside down. These symptoms can strike suddenly and leave you feeling utterly miserable. While these symptoms are often associated with a simple stomach bug or food poisoning, they can also be signs of something more serious, like pancreatic cancer. It's important to understand the potential underlying causes. As we've discussed, pancreatic cancer can interfere with digestion in a couple of ways. This interference can significantly impact your overall health and well-being. First, the tumor itself can obstruct the flow of food through the digestive tract, leading to a buildup of pressure that triggers nausea and vomiting. This obstruction can cause severe discomfort and disrupt your daily life. Second, the cancer can disrupt the production of digestive enzymes, making it difficult for your body to break down food properly. Without these enzymes, your body struggles to digest and absorb nutrients. This can lead to indigestion, bloating, and that all too familiar feeling of nausea that often precedes vomiting. These symptoms can be persistent and debilitating. Now I know what you're thinking. Dr. Mike, I get nauseous after a greasy meal sometimes. It's a common experience and not necessarily a cause for alarm. Does that mean I have pancreatic cancer? Of course not. Occasional nausea after a heavy or greasy meal is usually harmless. But if you experience persistent nausea and vomiting, especially if it's accompanied by other symptoms like abdominal pain, weight loss, or jaundice, it's crucial to see your doctor to rule out any serious underlying conditions. Early detection and diagnosis can make a significant difference in treatment outcomes. Diabetes. It's a chronic condition that affects millions of people worldwide, and it's often associated with lifestyle factors like diet and exercise. But did you know that pancreatic cancer can also lead to diabetes, even in people who have no prior history of the disease? Here's how it works. The pancreas is responsible for producing insulin, a hormone that regulates blood sugar levels. When pancreatic cancer develops, it can damage the insulin-producing cells, leading to a decrease in insulin production. This can cause blood sugar levels to rise, resulting in new-onset diabetes. Now, it's important to note that not everyone with pancreatic cancer will develop diabetes. However, if you're diagnosed with diabetes later in life, especially if you don't have any of the typical risk factors like obesity or a family history of the disease, it's essential to talk to your doctor about the possibility of pancreatic cancer. Blood clots. They're like tiny traffic jams in your bloodstream, and while they can happen to anyone, certain conditions like pancreatic cancer can significantly increase your risk. Pancreatic cancer can make your blood more likely to clot in a couple of ways. First, the tumor itself can release substances that promote clotting. Second, the cancer can damage blood vessels, creating rough spots where clots are more likely to form. These clots can travel throughout your body, causing serious problems if they lodge in vital organs like your lungs, heart, or brain. Symptoms of a blood clot can vary depending on the clot's location, but common signs include swelling, pain, or tenderness in your arms or legs, shortness of breath, chest pain, and coughing up blood. If you experience any of these symptoms, especially if you have other risk factors for pancreatic cancer, seek medical attention immediately. We've covered a lot of ground today, and I know it can be overwhelming to think about these serious health concerns. But remember, knowledge is power. By being aware of the symptoms of pancreatic cancer, you're taking a proactive step towards protecting your health. If you or someone you know is experiencing any of these symptoms, it's important to consult a healthcare professional immediately. Don't wait. Early detection can make a significant difference in treatment outcomes. Don't forget to like, share, and subscribe for more health tips and information. And as always, stay informed, stay healthy, and take care of yourselves.